Gambino, and I'm here today to talk to you about rotator cuff pain and posture, and why posture is so hugely important in preventing rotator cuff impingement and tears. So rotator cuff pain and impingement and tears, that is one of the most common things I see as the cause for shoulder pain in the aging adult. 30 to 50% of people by the age 60 are going to have some sort of problem with their shoulder, especially the rotator cuff. Why? Well, as we age, we get decreased blood supply to our tendons. Our tendons get a little bit more brittle and a little bit more like a dried rope and stuff. So that can cause one of the problems. Injury or overuse is often a cause. So, the weekend athlete or just overuse syndrome, doing something repetitively, can cause problems in those tendons. But the number one cause is usually posture and the mechanics of the shoulder. The shoulder is composed of course, the humerus, the scapula, which is on your back here, this nice triangular bone, and then of course the clavicle, and that's known as the shoulder girdle. The rotator cuff muscles hold this long bone into the socket, and they do the movements of the shoulder. There is a bone here that's not often talked about, and I call it the roof of the shoulder. It's the acromion, and the acromion comes off of the scapula, and it comes right over the top of the humerus. Underneath that roof and the top of the humerus lay your rotator cuff tendons and a bursa and nerves. And so if one of those tendons becomes inflamed, it becomes swollen, then that space between that roof and the top of the humerus there, that space is small, and so those tendons get even more squished upon and put pressure on them and stuff, so that you can get more and more pain, and then just moving your arm hurts. Okay, so what are the symptoms of an impingement or rotator cuff injury? Well, of course, pain. First thing you notice is some pain in your shoulder. You can't move your shoulder as well. You cannot maybe lift your arm all the way up into flexion, or you have trouble with abduction, which is lifting the arm up to the side. You have what we call a painful arc, which is pain between about 60 degrees and 120 degrees of this movement. The reason you have that is when you go to lift the arm out to the side, that little roof, because of the swollen tendons, is going to hit into everything that's right there between. As if I put my finger there and I go to lift up, I pinch that finger, and every time you go to move the arm, you pinch those tendons, and you just keep causing, basically like you keep hitting them with a hammer and keep re-injuring them. You're going to have pain when you have that painful arc. You're going to have shoulder weakness probably, and decreased motion, and pain. Trouble putting your hand behind your back, that's going to cause you problems, trouble and pain when you're doing your hair or blow drying your hair. Pain with sleeping, of course, and especially sleeping on that side. So those are all some of the symptoms that you can get. Diagnosis is going to be done by x-ray, of course, to look at the bony structure of the shoulder to see if there's any osteophytes, which are spurs that can be pushing on those tendons. Sometimes we get that going on. An MRI, of course, is going to be your best picture to see a rotator cuff tear or impingement. And then if you are sent to physical therapy, we'll do specific tests, or your orthopedic doctor will do specific tests to kind of rule out other problems and focus in on see if that is a true rotator cuff impingement. We can usually tell by a lot of some of the tests that we do, and palpation, when we kind of feel in there to feel the tendons. Then we usually hit the tendon and that's it. So how do we treat it? Well, first of all, if it's an overuse syndrome, we want to rest and use ice. And you can check out my video on ice massage for pain and tendonitis. And ice massage is one of the best things we can do for decreasing inflammation in that tendon. Rest, of course, if this is an overuse syndrome. So whatever you were doing repetitively, you're going to kind of slow down. You're going to keep your shoulder at a lower angle so that you're not pinching on those tendons. So your therapist will show you, or your trainer can show you, rest positions and activities of daily living to help decrease the stress on those tendons while they calm down, the inflammation goes down. Of course, over-the-counter pain medications or anything that your doctor prescribes as far as decreasing inflammation. Posture analysis is going to be the big one. Okay, so when you see your therapist or your trainer, they're really going to want to take a look at your head and neck posture. It's not just the shoulder posture. When we tend to have the rounded shoulders, that's what causes this when we change the position of the shoulder girdle. But also the rest of the spine, the mid spine, the back, your legs, because whenever you change position of your legs, that energy transfers up that whole chain and can change the posture of your shoulders. So that's going to be really, really important. Another thing that you can do, KT tape is something else that a therapist might do to you. It's this Kinesio Tape. It's a different kind of tape. It's a stretchy, when you tear this here, you can see it's a stretchy tape that we use. We apply to the skin. We put you in specific positions and then apply the tape. And then that tape can assist in movement and can help with blood flow. It can help with neuromuscular input to that area to help with healing and stuff. So KT tape is something that I use on the regular for helping with rotator cuff injuries. And of course, what you really, really want to do to prevent this is to make sure your posture is good and that you're going for regular posture training. You're not exercising in poor posture. You have really good alignment. You want a regular posture program to keep this shoulder in alignment, these muscles in the back here strong, these muscles in the front here lengthened so they're not pulling you forward into this slouchy posture. And that way we don't get that constant rubbing on those rotator cuff tendons, which causes them to fray, and then eventually they can spontaneously rupture, and that does happen. So you don't always have to have an injury or an impact injury, something like that, to cause your rotator cuff to tear. It can just happen from years of poor posture and overuse, just rubbing on those tendons, and then one day the rope just goes wink, and that's it, and you need surgery at that point. So to avoid that, get into a regular posture training program like Pilates. If you are interested in doing any type of exercises with me online, I'd love to have you there. The link is in the description box below. And if you have any questions, please put them in the comments box. Ideas for videos, I'd love to hear what you have to say and what you'd like to learn about. And if you like this video, give it a thumbs up and consider subscribing. I'd love to have you here. So thanks so much for joining me. Have a great day. Bye.